As the red summer sun rises and the birds begin their morning call, I get ready to lead this team of volunteers spanning various ages and backgrounds for another day working with communities across the state of El Paraíso, Honduras. The group's primary goal has been to collaborate with local physicians, pharmacists, and dentists to bring medical care to over 600 patients and distribute oral and personal hygiene supplies which they collected and packaged. However, over the course of the journey, they have also constructed eco-stoves to prevent pulmonary diseases in families, traveled to rural schools to hold engaging workshops, hands-on training, and spontaneous plays on dental care, and worked with local community volunteers to train a future generation of clinicians who can maintain their clinic and impact long after they leave the country.
However, the most meaningful experiences have been getting to know the locals and hearing their stories, breaking past the service mentality, and instead developing our passions in a way that embraces their diversity and values and advocates for patient autonomy. I'm often asked as a founder of MBGT what makes our organization unique and special. As a first-generation immigrant who's fluent in 5 languages, I've grown up in the midst of various multicultural experiences. I've understood the beauty of embracing others' perspectives, values, and beliefs, no matter how different they are from my own. Through my organization, I hope to nurture the drive to advocate and serve underserved populations who have unique yet unmet needs, medical or otherwise. Join us as Medical Brigades at GT celebrates and executes its first international trip and learn what it means to be a true global physician.
Dedicated to creating a meaningful and positive change, a team was assembled from college students, local community members, and others who are committed to a shared mission. Over the course of months, this group of over 30 began collecting medical supplies, spreading the word about its mission by community events, and collaborating with local nonprofit organizations and safety net clinics. In fact, this endeavor would have been impossible without multiple generous and enthusiastic sponsors. A large, heartfelt message of gratitude to the following: Ms. Kurdeen Karim from Design for Refugees, Call Rail Incorporated, Dr. Jaime Sacoto of the Latin American Medical Center, the Connecticut Valley Adventist Church, Mr. Madhu Reddy of Reddy Realty, and countless other individuals who mobilized to support the team and their mission. Soon, they were ready to embark on a life-changing journey. But first, they needed to understand the impact and implications of their actions. Throughout the process, the team was focused on making sure they left a long-lasting impact that did not take away from local workers, but instead provided services that would otherwise be neglected. While those fluent in Spanish or having some level of medical certification were able to put their skills to use, the rest of the volunteers were committed to educating the community through public health workshops, distributing personal and oral health hygiene supplies, and getting to understand the structural issues faced by the patients. By taking the time to listen to and reflect on each individual's unique story, each volunteer had a realistic and intricate understanding of their personal impact and contributions.
For many members of the team, this experience helped them understand the impact and consequences of issues such as the lack of utilities, clean water, electricity, and adequate ventilation. Whereas for others, they appreciated the chance to understand socio-cultural and systemic barriers to proper medical care. Demonstrating thoughtful reflection and actively addressing such issues is what makes Medical Brigades at GT so unique and impactful. Not only do I search for ways to expand our understanding of external forces on healthcare, but I hope to lead a team of like-minded individuals as we develop into inclusive leaders in medicine. This organization is built on the principles of constant growth and development based on our past experiences, and thus we always strive to expand and improve our actions.
Thus, it comes as no surprise that this trip was nothing short of inspirational, eye-opening, and transformative. From day one, the team was immersed in an authentic, cultural, and informative experience, from long winding rides in a small van throughout the country to having a thorough meet and greet with supporting staff, community members, and medical providers. The next day, the team set out to the beautiful mountaintop community of El Osete to learn about the livelihoods of rural villages and help the local masons in constructing eco-stoves for the women to improve kitchen ventilation and prevent pulmonary diseases. Throughout the construction project, they were able to interact with various families, learn about their backgrounds, and understand how their community has shifted to thrive in an increasingly difficult environment.
Awesome. Thank you. Thank you.
Today we made eco stoves in a community in Honduras. I first began by sifting sand that we would use to make the cement, and I kind of rotated into sifting the ashes for the eco stove, and then in the end I also joined in making the actual eco stove using cement.
Like, we were building something from scratch, like something that was not there, and we put it together. So I felt very accomplished after.
One of the women, Yonelica, shares how this will impact her lifestyle and ultimately her and her family's health. ¿Cuántas personas vivan en su casa?
4.
¿Usted y?
Mis 2 niños, mi compañero.
¿Y usted cocina aquí o en la casa? ¿Y cuántas horas usted hace en la cocina?
Mucha gente todo el día, los de 6 horas.
¿Y usted cree que es malo para su salud?
Cocinar en el fogón de ahorita.
Sí.
No, bueno, en los anteriores creo que sí, por el humo y todo eso. Pero ya en esto ya no, porque ya no lo explico. Por lo del humo, pues.
Sí.
Por el cáncer de él. Ay, Dios mío, yo no sé.
Sí, sí. We were able to go into the house of one of the families who live in Suyapa and create an eco stove from them to replace what they currently have, which is a wood stove, which produces a lot of smoke and fumes for the women who have to cook, which ends up leading to pulmonary disease and eventually death. Although you wouldn't expect this from a medical brigade, this experience was nothing short of having a colossal impact on the family members we met today. We were not only able to provide them with a sustainable way of cooking and going about their lives, but we also provided their families and the women in their families who would cook to get a way to prevent lung cancer and pulmonary diseases. So we hope that this project shows that medical brigades doesn't only have to be about working in clinics, but can have multiple impacts in multiple ways.
Mi persona y de todos mis colaboradores. Creo que es de muy buena ayuda las medicinas que han traído, porque hay bastantes personas de bajos recursos que con esta medicina creo que se van a abastecer un poco de sus necesidades y esperamos tenerlos muy pronto por aquí. Gracias.
Taking this newfound understanding of Honduran culture and social values, the team began setting up the clinic. Using the classrooms of a government school that was closed for the holidays, they created stations for primary and OBGYN care, pharmacy, dentistry, triage, and educational workshops. From fluoride treatments for all the children in the community, to pap smears for the women, to a variety of physical, dental, and psychological illnesses, the volunteers played a direct role in addressing these medical conditions and procedures. It was not only a way to ensure that the clinic could process as many patients as possible, but a way to understand and address the issues we saw across the days. This way, we could adjust our services to better support the population our clinic was meant to serve. By rotating and experiencing all aspects of patient care, each team member was able to interact with patients in various contexts. Moreover, each patient conversation was a reminder of the stark differences between the healthcare accessible in the United States and the system in which the patients were living. Every night, the team reflected on their experiences through group discussions and presentations on the current medical system by the physicians were given. By the end, there was an enriched sense of the roles and responsibilities of physician and global citizen, no matter the community or environment in which they were practicing or serving. As a leader, my experience was twofolded. As a Spanish-speaking member of the team and a certified medical assistant with clinical experience, I was immersed in providing the best care I could and refining my patient care and cultural skills. However, as I oversaw the other volunteers and worked with the community to determine how we can leave our clinic functional after departure, I was exposed to a completely new perspective on community building and improvement. Breaking past stereotypes and adapting to low or no resource settings helped me understand a new side of healthcare and understand its role in improving the livelihoods of not just individuals, but entire families and communities.
Seeing how individuals who are motivated to serve can make such a big difference through such humble first steps fueled my drive to ensure that my organization will always work towards its mission in whichever way that we can.
To see another part of the medical field as medical assistant was pretty amazing because it was so helpful. While we were on the consultations, I saw how everybody was involved with doing all the procedures and participating with the community. I saw how you get to influence the people. It was amazing to do that. Also, I really loved the way that how kids really were very receptive by the songs that you were singing, by everything that you were showing to them. They really loved that, how you were very attentive to them, and also I really liked how were you able to sit in front of the patient and ask them what were their chief complaints and everything. Now you know how to treat little stuff like common colds that it was pretty common here, and also like other chronic diseases like hypertension and diabetes. So I really loved most of all the evolution that you got as being professionals. So it was really amazing to see you guys with the patient. It was really amazing to see how beautiful it was, the interaction that you had with them, and I really hope that you guys come soon to our country again.
Overall, the team witnessed countless procedures and medical feats, observed how providers can resolve psychological and cultural barriers, and understood the consequences of one's financial or familial situation on their health. Being able to serve multiple communities and diverse populations taught the group appreciation and cultural sensitivity, but also reinvigorated a desire to use one's skills, knowledge, and resources to evolve an understanding of a population's needs, assess and refine his or her work, and develop programs that deliver meaningful change. This did not have to be only on an international scale. Atlanta and Georgia represent a wide spectrum of cultures, and providers must be sensitive to the diversity of backgrounds and values they encounter on a daily basis. Thus, the team has been committed to working with local safety net clinics to work directly with local minority and disadvantaged populations, whether it is through direct patient care or helping them acquire the legal and financial means to access proper health care.
As our experiences equip us with nuanced knowledge of why certain illnesses are amplified in underserved populations, we can identify how to address this clinically and join communities built on shared goals, hardships, and diversity. Having already caught the eye of news channels such as Fox News, I hope to expand this organization and community of committed individuals who respect and value each other's values, aspirations, and well-being. Overall, I hope that my never-ending passion will help foster a program that edifies social commitment and international responsibility.
This is why Medical Brigades at GT is excited to announce our second international mission. From January 2nd to January 7th, 2024, our team will be traveling to the Dominican Republic, this time working with the organization Service for Peace to support local government hospitals in maintaining adequate patient services despite their large capacities. Furthermore, the communities we will be living in and serving are working on constructing their water infrastructure. Our team will be assisting and learning from these engineers in developing a sustainable water management system. To support and learn about our team, please visit our Instagram page, our website, or contact us directly at gtmedicalbrigade@gmail.com. We look forward to working with you to achieve healthcare equity and sustainable social growth for all.
Si te gusta la banana, banana, me digo bagusa, banana, like banana.